So this mess. Yeah. So the eye is still pretty deep ulcer. When we stain it, if it's solid colored, usually means it's superficial. If it's kind of almost looks like it's outlined, like almost like there's no stain in the middle, but there's stain on the outside, usually indicates it's deep, which is what it was. I'm just worried that we've been treating it for quite a while. We're not seeing the kind of improvement that I would expect. Normally the eye heals up very fast. So, I mean, we have a couple of options, okay? One is going to be that we keep doing what you're doing, and hope that it's, that it heals up at some point, and it just takes longer, Look, the alternative is, there is a procedure that we can do where we basically temporarily suture the third eyelid over the eye, and it kind of provides like a protective shield. Because what happens a lot of times is that these things keep drying out, even though you're putting in the drops as frequently, which is awesome. Most people don't do that. But they dry out, they get irritated from stuff in the air, and so this basically protects it, so to allow it to kind of like heal up a little better. But it is a procedure that requires us to put them under in twice, so we have to put them under once to tack it down, and then another to get it, kind of take it back off. I don't think that, so right now, as far as drops, are you just doing the serum drops right now?
The serum, and then they gave me another bottle of drops.
The antibiotic, okay, good. I want to make sure you're on the antibiotic.
Yeah.
Okay, good. I mean, that's kind of our options, let's keep going.
She's a street dog's dog.
I know. And I just want to give you all the options so that you guys have them. There's nothing wrong with keep treating it and see if it gets better. I just want to make sure you know that there's those are all the options that we have. As far as the back legs, both knees to me feel like they've had, cruciate tears at some point or another. They're both very thickened. It's kind of a common response whenever they've torn a ligament back there, is that the knee area gets what they call buttress, which is just like thickening of that bone back there. Neither one of them is loose right now, but they're both thickened. The hips are a little bit tight as well. It's most likely just arthritis that would kind of flared up, and that we're, because of the previous tears, there's some arthritis in there. Sometimes what can happen also is that there's scar tissue, that's what's causing that thickening. Sometimes they can tear some of that scar tissue somehow. It's almost like re-tearing a ligament, as far as like what it feels to them. But it will heal itself back up. So generally, anti-inflammatories for 7 to 10 days and seeing how they do on that. So we can.
Mayor's talked about some kind of a shot I can give her once a month, that maybe you could prescribe that, I guess, for pain.
So there's a couple of different options that are available. One is Adequan, which helps rebuild some of the cartilage in the joints. It's twice a week for 8 weeks, and then once a month after that. Twice a week for 4 weeks, 8 injections. So the first month is 8 injections, and after that's once a month. I have a lot of patients that are on it, they do very well on it. It works by rebuilding the cartilage in the joints. So there's nothing to control pain, but by rebuilding the cartilage in the joints, theoretically that's what helps relieve the pain for them, is that the cartilage is what protects the joint. The other one is a newer medication called Librela, and so it is a once a month injection that blocks the pain receptors in those joints. But that one is one that we have to come in for. We can't send home with you. The Adequan I can send home with you, but the other one, the Librela, we can't send home. So those are kind of the two options that we have as far as injections. They both work very well for what they do. I am a big fan of the Adequan. I think it does help. I have numerous patients that are on it, and so, like I said, if that's something that you guys want to try and see if it helps.
With the shape of her legs, do you think it would help?
That's always the question. I don't know. So there has to be some sort of cartilage there to rebuild, right? So it can't rebuild from nothing. So there needs to be some sort of matrix of cartilage in some form that's still there, albeit damaged, but still there. But if they've worn down all the cartilage in their joints, they can't rebuild nothing, So
right.
that's the one downside to the medication and why it doesn't work sometimes. They just don't have anything to rebuild, and so. But it's hard to know until we treat them. Usually for that eight injection period in the first month, if they're going to respond, they're going to respond that first month, and after that we decide if we're going to keep them going forward or not.
And so you were saying something about she takes some kind of medication for.
So yeah, just an anti-inflammatory similar to like Rivotril or Ibuprofen. It is similar to ibuprofen for us, but ibuprofen will leave Tylenol or toxic to them. So it works in a way that's in a similar like function, but it's safe for them, the one that we prescribe for you. So it's an anti-inflammatory. It's just relieve pain, and like it's like you spraining something and taking some ibuprofen for a week until it gets better. It's the same principle. It's just
well, I think it got aggravated because of the drops every 2 hours. I've had to take her like everywhere with me.
Right.
I go do stuff for street dogs all day long,
Right.
and so putting her in the car and getting her out has been really difficult. I can't lift her, and then she gets in the back seat, and then she just kind of stands, and I make her lay down, but then she gets back up, and I think she's had a lot more activity on those legs, and
with the arthritis she likely has in there, that'll irritate it. So but like I said, I think the anti-inflammatory would help. The anti-inflammatory, the adequate is more of a long-term solution. The anti-inflammatory is more of a like, okay, this is just let's get it better now kind of thing. Now, we may treat for 7 to 10 days, it may get better, and then when we stop, it may continue, but then that's when we start talking about long-term solutions. I'd rather not be on the anti-inflammatory long-term if we can avoid it. It's just like taking ibuprofen every single day for us. It's not great, right? So we can do it if we have to, but I try not to. So, but for a week to 10 days, and see if that helps the inflammation, then it can be very helpful.
Yeah, that's probably good. And then I think you're going to have to talk to Maris about all the rest. That's really complicated. And
that's fine. No, let me get the anti-inflammatory together for you, and then.
Okay, and then maybe if I don't have to bring her back, if she wants to do that Adequan, if you two could just call in a prescription or whatever if she wants to try that.
Okay. Yep. Let me let's see here. So do you want to start the Adequan, or do you want me to talk to her first before we do that?
What do you do to start it? Just
So I usually just sell you the bottle of it, and I have one of the technicians show you how to give the injection. It's just underneath the skin. It's not.
Yeah, Maris told me she could show me how to do it.
So we'll be getting you the bottle of it. Yeah.
Okay. Well, Cheryl said maybe we could go ahead and start that, and then that you all could do the first one, and you could show me, and then give us a prescription to get more.
Right. So yeah, if we can give you we can show you how the first bottle how to do it. Yeah.
Okay.
Yep.
Yeah, I guess do that, and then what, I get the Rimadyl too?
Yep.
Okay.
They're safe together, so.
Okay, and then they'll have to figure out about the eye.
Okay. Yeah. No, that's fine. Let me do that. I'll be right back. Okay.
Okay. Is that serum expensive that goes in her eyes?
I think it's like $25 whatever. Because we have to draw the blood, spin it down, So
Well, if I'm going to go ahead and do that, maybe I should go ahead and get some more.
Because
Because I know you have to get her blood, blood. So.
Right. Yeah. That's fine. Let me get the technician with that done. Okay.
Okay.
Be right back.